Blood distribution. The vascular shunt according to getrevising.co.uk. A vascular shunt refers to the distribution of blood around the body. During exercise, the vascular system redistributes blood to areas with the greatest demand for oxygen, away from areas with lower demand for oxygen. This is done when the precapillary sphincters close at non-essential organs, such as the bladder, so that blood is directed to the working muscles to supply them with oxygen. Shunting is also referring to the movement when the skeletal muscle pump is aiding venous return. Vasodilation is where blood vessels will increase in width, and this will lead to a decrease in blood pressure because less blood is being forced through a smaller gap. During exercise, the blood vessels will vasodilate because more blood is needed, so they open to let more blood back to the heart. Vasoconstriction is where blood vessels will reduce in width and can be used during thermoregulation so that heat is retained and does not escape. The blood vessels will constrict after exercise when less blood needs to be distributed around the body. The distribution of blood around the body is also done when Blood flow. During exercise, the blood flow will increase because the heart is beating faster and harder. As well as this, more blood is needed around the body to supply working muscles with oxygen and to eradicate lactic acid. There will also be an increase in venous return because more blood is flowing around the body. The blood flow will then plateau, which is because the stroke volume will plateau as well. There will then be a rapid decrease in blood flow after the exercise. Thermoregulation. During steady-state exercise, there will be an increase in sweating because as muscles begin to work harder, as muscles begin to work harder, their heat increases. This increase in heat will create H2O. Thermoregulation includes vasodilation to release heat and vasoconstriction to hold heat. A message is sent from the thermoreceptors after a detection that shows a change in temperature. The message goes to the hypothalamus via the central nervous system, and then a signal is sent to the vital organs or blood vessels, which will either release heat or hold heat. Venous return. Valves are spaced at equal intervals within veins, which means that there is one-way return back to the heart for blood. Venous return is the blood that is pumped around the body and back to the heart. Muscles on either side of the vein contract, which forces blood through the veins. Veins contract because of low venous pressure, or, in the case of steady-state exercise, muscular contractions will aid venous return, according to BTEC Level 3, National Sport 2010. Venous return is also called vascular shunting. Venous return is aided by the skeletal muscle pump, which is when the muscles contract on either side of the veins. The valves will also shut to prevent unwanted backflow of blood. Starling's law. The law states that the stroke volume of the heart increases in response to an increase in the volume of blood in the ventricles before contraction, when all other factors remain constant. So if there is an increase in exercise intensity, then more blood will flow into the heart, which means that according to Starling's law, there will be an increase in stroke volume until it reaches steady state, where there is no increase in exercise intensity. This also means when there is a decrease in blood flow and a lower volume of blood in the ventricles, there will also be a decrease in stroke volume. The reference to more blood reaching the atria after every pump also relates to venous return. If venous return occurs at a higher rate and more blood returns to the heart, then stroke volume will also increase according to Starling's law. The respiratory system. Breathing rate. As exercise intensity increases, so does the breathing rate. Breathing rate will also plateau, and there will be an increase in breathing rate because there is an increased resistance at the start of exercise, and more oxygen is needed at working muscles. Breathing rate will then plateau because the demand for exercise will not increase because enough oxygen is being supplied to the working muscles. There is then a rapid decrease in breathing rate after the exercise. This is because there is a small oxygen debt to pay off. The way that breathing rate increases is a signal is sent to the respiratory control center. A signal is then sent to the external intercostal muscles, which means that there is a more forceful contraction, which means that the thoracic cavity will open up larger and lungs will be able to fill with oxygen. An elite athlete could also have a lower breathing rate than an untrained individual because they have stronger external intercostal muscles. Or taller athletes such as basketball players have a larger thoracic cavity, which means that their lungs will consistently have a larger tidal volume. Tidal volume. During steady-state exercise, there will be a gradual increase in tidal volume because there is an increased resistance and the working muscles require more oxygen. The tidal volume will then plateau because there is enough oxygen being supplied to the working muscles, as well as there being a maximum capacity that our lungs can fill up to with air. There is then a rapid decrease in tidal volume because less oxygen needs to be supplied to the working muscles, and the amount of air in a single breath is decreased. During exercise, many elite athletes take deeper breaths because it is more efficient than breathing rate increase. As well as this, when runners such as Mo Farah run at a steady state, they can get into a rhythm which correlates with an efficient breathing rate and breathing deeper. As well as this, during steady state exercise, some athletes may need to have forceful breathing out, which is done by the internal intercostal muscles. The oxygen dissociation curve and its effects. An increase in temperature shifts the curve to the right, whilst a decrease in temperature shifts the curve to the left. Increasing the temperature denatures the bond between oxygen and hemoglobin, which increases the amount of oxygen in hemoglobin and decreases the concentration of oxyhemoglobin. The oxygen dissociation curve is the relationship between the partial pressure of oxygen, x-axis, and the oxygen saturation, y-axis. A left shift on the graph indicates an increased oxygen affinity, the degree to which a substance will combine with another, of hemoglobin, which allows less oxygen to be available to tissue. A decrease in pH, which is an increase in acidity, shifts the curve to the right, while an increase in pH shifts the curve to the left. So a left shift on the graph indicates that the degree to which oxygen will bind to hemoglobin is increased. When the graph shows a shift to the right, there is a decreased oxygen affinity, meaning there is a lower oxygen affinity for hemoglobin. During exercise, the graph will shift to the right because there is an increase in body temperature as well when we exercise. Neuromuscular response to steady-state exercise. The Golgi tendon organ is a proprioceptive sensory receptor organ which detects the tension of the muscle. Golgi tendons are located at the origin of the muscle fibers. This also means that the Golgi tendons are part of the peripheral nervous system. As a muscle contracts and shortens, they increase the tension within the muscle. When a muscle has reached a point where the Golgi tendon organ thinks the tension is too great and is at a point that could cause harm, it sends a signal through a sensory neuron to the CNS, where the inhibitory interneuron is activated. This forces the muscles to relax and prevents tension from increasing. According to psych.athabasco.ca, as we exercise, there will be more information being sent from the Golgi tendons to our central nervous system, and the information is usually about the strength of the contraction. It is also the job of the Golgi tendons and the muscle spindles to facilitate smooth movement patterns, and heat increases the speed of transmissions. So thermoregulation and the Golgi tendon organ will all begin to be very active during exercise and will remain active so that they can maintain that level during steady state exercise. Muscle pliability. Ligaments and tendons will increase in flexibility and strength with regular exercise. Athletes require stronger tendons and more pliable ligaments to handle the demands of exercise. The warming of your muscles means that they will become more pliable, which means there is less risk of injury. This according to Louise Sutton, 2002. This statement is saying that as we increase the exercise intensity, the muscles, tendons, and ligaments will become more pliable, and as a result will also strengthen. However, in different movements, the muscle will become pliable in different ways. For this exercise, the participants will be cycling, which means the gastrocnemius, gluteus maximus, quadricep, and the hamstrings will be used. As the participants reach the steady stage, they will find that their exercise can be maintained for 15 minutes, which means the flexibility and pliability of muscles will be maintained throughout the exercise.